Each year, over 730,000 individuals are released from prison and return to communities across the country. Their ability to remain law-abiding citizens is of critical importance to community safety and to reducing the burden of incarceration costs on strapped state budgets. The Federal Second Chance Act provides significant funding to support services and programs to encourage successful reentry and sets as a goal significant reductions in recidivism as a result. This webcast describes a new resource available for 2009 and 2010 Second Chance Act state demonstration sites to assist them in strategic planning regarding more effective offender reentry.
This is a critically important moment in the reentry movement. For the past 10 or 15 years, the public has been focused like never before on something that corrections officials have known for a long time, which is that everybody who comes to prison, unless they die there, they all come home. So with that public focus comes a high degree of accountability for results. This is now underscored by the fact that the fiscal realities of the country mean that those results have to be cost effective. So this focus means that we have to come together in ways we've never come together before to produce those results. So it means that health officials, corrections officials, people who work at the community level, people who work at the education field, have to focus on improving outcomes for the people who come home from prison. That requires collaboration, requires the development of strategic plans at the state level, requires cabinets to come together, requires task forces. So never before have we seen this imperative for people to work together to produce results that'll benefit not only the returning individuals, but their families and their communities.
This webcast and the available assistance to follow during 2011 are a joint effort of organizations with decades of experience in helping justice agencies manage change and implement improved practices. The Center for Effective Public Policy, or CEPP, is a nonprofit organization which has had a lead role in working with the National Institute of Corrections on its Transition from Prison to the Community initiative. Northpointe Institute for Public Management is an organization that has developed, tested, and worked with justice agencies to implement a number of key evidence-based practices. The National Reentry Resource Center, which provides direct technical assistance on program design and implementation, is also working closely with CEPP and Northpointe. These partners are leading the effort. Funding is provided by the Public Welfare Foundation, a private foundation with more than 60 years' experience in supporting efforts to benefit communities and individuals. This effort has sought guidance and advice from the organizations leading reentry efforts across the nation, including the Bureau of Justice Assistance, which is administering the Second Chance Act, and the National Institute of Corrections, which led the development of the Transition from Prison to the Community initiative, both agencies of the U.S. Department of Justice. Research leaders, the Urban Institute and John Jay College of Criminal Justice, are also advising the project. The project team and its advisory group met in the fall of 2010 at the True Reformers Building, the headquarters of the Public Welfare Foundation. The groups discussed the importance of collaborative, strategic planning to assure the success of reentry efforts. Following are excerpts from the group's discussion and from interviews with individual advisors.
So Seema, the Public Welfare Foundation has funded this project. What's your ultimate goal?
The Second Chance Act, as a piece of federal policy, it demonstrates a sea change in criminal justice thinking at the federal level and at the level of policymakers. That is moving from tough on crime versus soft on crime dynamic into more reasonable thought about how to make communities safer and how to make our systems better. And I think there's a lot of excitement among philanthropies, and certainly at this foundation and other foundations that we work with, because there are things that we can look to. There are examples where, in fact, you can cut recidivism, you can improve outcomes in corrections, you can increase public safety, and you can do it tapping into the research that has developed over the last couple of years.
Well, I think that for a number of jurisdictions there are a lot of well-intended efforts underway, but they aren't necessarily coordinated in any particular way. And as those different programs and projects play out, they touch each other in a variety of ways, but there's opportunities there to take advantage of the good work being done in individual aspects of offender reentry work, and to the extent we can help people emerge from their individual program silos and participate together in a broader discussion about where they want to go, the more likely that they can accomplish the true objectives of not only that project or program, but of their state.
What have we accomplished in recent years that might give some encouragement to the Second Chance Act demonstration sites at this time?
I think the most important thing is that over the past decade plus, we now have developed a language of practice, that we now talk about reentry as something that is of policy concern and concern to the public. And that has enormous value. There's been significant federal investments through a number of federal agencies in bringing states along and thinking about how to improve reentry outcomes. I think there's a very high public expectation that we will deliver on those promises, and that creates some accountability back to public officials. And I think there's a much better understanding from a evidence perspective as to what works, what doesn't, how to intervene appropriately, what are good risk assessment devices. And the challenge now for all of us in this field is to think about how to take that momentum, which is pretty considerable, and the investment, and shift our way of thinking as a collection of agencies, public and private, to improve outcomes for the public. And it's an exciting time to be in the field.
The Second Chance Act is probably one of the most significant pieces of federal legislation that's been enacted in a good number of years. It's important on several different levels. One, it provides resources to units of state and local government and tribes, but also to private nonprofits to address the issue. So it serves as a catalyst through the provision of federal resources to involve a broad base of service providers in addressing the issues of prisoner or offender reentry. I think that in order for all of those moving parts to work effectively together, it really begs for a strong strategic planning effort. So I think this particular project that the Public Welfare Foundation is funding is going to be very important, because it will help really more narrowly focus ideas and issues around the need for system-wide strategic planning.
And so even if we work in the same agencies, institutions, probation and parole, all presumably in a single Department of Corrections, we hunker down in our own bunker there, and we work on the activities that belong to us. So the real challenge for corrections has been, if our real mission is to reduce the number of new crimes and the number of new victims created by people who are under our management, how do we work together to understand what bodies of knowledge inform us how to do that? How do we bridge the gaps between the time that a person's in an institution and the things that you can realistically be doing with that person in the institution that don't just have them be a good citizen in the institution, but really prepares them to be a good citizen on the street? You know, we've watched jurisdictions that struggle with this whole business process. And as Jeremy said, I mean, we do have an industry standard now that we didn't have 10, 12 years ago when we started talking about reentry and transition. I think the framework that you're carrying out to the field, and particularly in a year when we're going to see a lot of new governors coming on the scene, provides the kind of framework for dynamic leaders who are heading these organizations. Leaders who are very focused on outcome and not just on program. Leaders who come at this business with a passion and desire to make some positive change. I think you provide them a framework that they can begin to have that dialogue with new governors at the very beginning of an administration, and hopefully have the time, because this is hard work. It takes a long time to put the pieces in place sufficiently that you can begin to measure results, that you can begin to have quality assurance, that you can begin to talk about sustainability.
The two project co-directors, Peggy Burke of the Center for Effective Public Policy and Dennis Schrantz of Northpointe Institute for Public Management, introduce the basics of strategic planning and how to access assistance.
The purpose of this project is to encourage and support Second Chance Act state adult demonstration sites to engage in strategic, system-wide, state-level planning. We are looking to work with state correctional leaders and others to explore how best to assure that Second Chance Act resources have the kind of impact that we all hope for, impact in terms of public safety increases and reductions in recidivism.
After viewing this webcast, you'll be asked to submit the technical assistance request form that you've received prior to seeing this webcast. We also encourage you to review the document that outlines the very process that we're recommending, the TPC Reentry Handbook. You'll be able to find the link to that handbook at the end of this broadcast.
Of course, commitment and leadership are key to this effort, and so as each site completes its request for assistance form, we're asking that you indicate your commitment to bring the key leadership to the table and your commitment to stay at the table and work with us over a period of months on this important process.
We're now going to walk quickly through the steps of the strategic planning process. And we're going to begin with a definition of what strategic planning is. After that definition, and after each of the steps of the process, we'll hear from our team members about examples and challenges that they faced in doing this work in several states and jurisdictions across the United States.
A strategic plan is a carefully constructed and documented set of activities that states use to demonstrate how they're implementing their mission and vision for improving the outcomes of people returning from prisons back to the community. Basically, a strategic plan outlines who does what, when. And it's a way to structure the collaborative partnerships and all the people and agencies and organizations that need to be involved in improving the outcomes of people returning back home. Strategic planning is also an opportunity to build agreement about the different roles that agencies and different actors within systems need to play, whether it be inside prisons or parole or community partners. Structuring that collaboration lets you build agreement over time to make sure that people follow through with the decisions that are made.
I would say that, given some of the things that Seema talked about the novelty of this legislation, at least in our current era, there's an opportunity for us to embrace that outcome, as difficult as it may seem today, in terms of both recidivism reduction and increasing public safety, and try and step back from that to create a narrative that says how we plan to get there as a piece of policy and as individual systems trying to get there, and even the agencies within those systems, so that there becomes a clear roadmap about how we get from the place that we are today, wherever that place may be, to a place where we have more competence and more capacity in the future to achieve the outcomes that today may seem distant, but that are nonetheless helpful in providing leadership and guidance to where we want to get.
We are now going to introduce the 10 steps of a strategic planning process to give viewers an idea of the work we are suggesting it is important to undertake. We will describe each step, and then we will hear from our project team and advisors about that particular step and how it has been useful in improving our approach to offender reentry. Step 1 in the strategic planning process is to create and charter a strategic planning team. Step 2 is to develop a clear vision and mission. Step 3 is to get organized and agree on roles and specific tasks. Step 4 is to understand current practice, policy, and populations. Step 5 is to align with evidence-based practice. In other words, do what works. Step 6 is to conduct a gaps analysis. What is the gap between where you are now and where you want to be in the future? Step 7 is to identify priority targets of change. Step 8 is to develop an implementation plan. Step 9 is to execute, monitor, and adjust that plan and correct as you go forward. And Step 10 is to evaluate your efforts.
The first step in the strategic planning process is to create and charter a strategic planning team. It is important to get the key stakeholders at the table. This includes those responsible for prisons, usually the Department of Corrections, for release decisions, the paroling authority, and for post-release supervision, again, the Department of Corrections, or a separate agency. Other stakeholders may be appropriate in a particular state, but the key correctional agencies are essential. These stakeholders should agree that it is important for them to work together on this strategic planning and to commit time and effort to the steps that will follow. Further, they need to agree that they are willing to consider changes in the way they are currently operating to achieve more successful reentry. Ultimately, as the planning process goes forward, it will probably be helpful to involve stakeholders at the local level as well. But in these initial stages, it is essential for the key state-level justice agencies to be involved.
In some of the states where we work, the governor has created an executive order which requires the development and the implementation of a statewide policy team. That's been really important to the strategic planning process in each of those states. That requires a cabinet-level, cross-agency collaboration and puts in place a more lengthy and deliberate strategic planning process, one of which is a really important part of this work and certainly for the success of the Second Chance Act.
The second step in the process is to develop a clear vision and mission. A clear and elevating vision can keep our teams at the task, even when there are difficulties. A shared vision of safer communities, stronger families, better use of the public dollar are some of the ways we envision our future if we're successful with reentry efforts. A strategic planning team can be motivated, inspired, and focused by such a vision. And developing such a vision is an important place to start in the process. The team will be encouraged to ask and answer the question, how will Second Chance Act resources and our joint efforts make a difference in the future of our state? And what can we do together to get closer to that vision? This leads to a clear agreement about the mission of the team, that work that will bring us closer to the vision. Doing the work of defining an elevated vision and a clear mission sets a team on the path to success.
In working with jurisdictions around the country, I found that this issue of having a clear vision and mission is critical to the success of the organization in moving forward. We wouldn't start a journey in a car without knowing where we wanted to go. And in our work in offender reentry, we need to apply the same philosophy. We need to start with the end in mind. And when we do that, we have a much better chance of arriving at our intended destination. I like to think of a vision as a preferred future. This is the place that we would like to wind up. And as we contemplate the preferred future in our offender reentry work, there's a few key thoughts that seem to emerge in a number of jurisdictions like Michigan and Missouri and Georgia that have pursued vision and mission statements around offender reentry. And these three key themes seem to focus on, number one, a desire to positively impact public safety. Number two, to work collaboratively to develop a seamless offender reentry system. And number three, that these jurisdictions, in working collaboratively and in working towards this promoting public safety, are also interested in promoting offender success. It is through offender success that they find that they are ultimately able to achieve their broader public safety objectives.
The next step in the strategic planning process is to get organized by putting together a detailed work plan. Strategic planning is a complicated undertaking, so you need to get organized and have a plan to get to the plan. The first stage is agreeing on roles and responsibilities of your team and of any working groups you commission. You need to have a process for assigning specific work tasks, deadlines, and a schedule for getting feedback from the working groups.
Early on in the process, the statewide steering team in Missouri understood that there was much work to do. And in looking at the TPC model, for instance, they knew that there were a variety of things that need to be assessed. And so they decided they had to divide that work out. But they were very clear about how they wanted to divide that work. They wanted to look at the offender population, who they had, who they were dealing with. They wanted to look at resources. They wanted to do some system mapping. They wanted to look at policy in terms of how we're intervening and assessing clients and identify the gaps, the whole gamut of issues. I think one of the most important things that Missouri did was they decided to have very strict charters for each group. And those charters basically outlined the mission of the group, gave good background in terms of their particular issue, very good parameters in terms of what was expected, what their parameters were in terms of decision making, clear definition of the products, and a very specific timeline.
The fourth step of the process is developing a shared understanding among the key stakeholders of exactly where you are now, and is a critical step in the strategic planning process. The system is fragmented, so different stakeholders may have very different perspectives. Working together to understand exactly how cases flow through the system, what practices are in places, and how resources are currently deployed are significant tasks. But as the team does this work, they develop a shared understanding of the current situation, its strengths, and its challenges. Basically, you cannot really chart a clear course of how to get where you want to go until you all understand and agree where you are now. Importantly, this process develops a shared understanding that can lead to a shared commitment to the elements of your strategic plan as it develops.
One of the most important things, I believe, in a strategic planning process is the understanding of current practice in states, to understand where we are so we know how we can get from here to our larger vision about where we want to go. So in some states, for example in Michigan, where they have taken a catalog of all of their programming within institutions and whether it meets the test of evidence-based practice, it gives them a real clue as to what they keep, what they get rid of, what they move forward with, and where they're short on resources and therefore what their planning should be like. That's going to be a really important part of the Second Chance Act and how states move forward in thinking about what they really need in relation to what they already got.
In step 5, the team will explore how current practice aligns with evidence-based practice. In this step, your team will likely identify practices that are ineffective that you will want to explore discontinuing for funding and redeploying those resources. This may be able to alleviate some of the pressures of tight budgets and stretch your resources. One basic area of practice that calls for alignment with the principles of evidence-based practice is that of offender assessment. It is critical that you have valid, reliable, empirically based assessments of risk and criminogenic need in place in your system. And just as importantly, you will need to use those assessments to guide other aspects of your business practice, those that can assure that the right offenders, in terms of their assessed level of risk and criminogenic need, get into those programs at the appropriate time and at the appropriate level of intensity.
Well, I think a good example of this part of the process in strategic planning is to make sure that we target offenders at the right stage and with the right characteristics, and then apply the best possible resources we can to achieve the desired results. I think there's an excellent example in Missouri where they went through as part of the Transition from Prison to Community initiative and actually chartered a team to look at the supervision practices in Missouri. And as a result, developed the evidence-based or excellence-based supervision process where they target offenders that's driven by assessment and then deliver the kind of services that we know provide the results that we're looking for. I think it makes sense from a correction standpoint that we're making good use of those resources, but from a taxpayer's perspective, I think it's also important that we use the fiscal dollars that are available in the best possible way.
I would say that in general, we've relied on a particular approach to trying to motivate offenders, and that is to threaten them, to punish them, to try and encourage them to do things because there were negative consequences if they didn't. And what we've learned, I guess, finally, ultimately, is that that's just a poor way to motivate people to move forward with behavior change. And that as we learn through the application of science and research and looking at other fields and the results from other fields, we begin to appreciate the value of using positive reinforcement, using encouraging statements, of finding a way to tap into people's strengths and building on strengths so that we begin to move people in a direction in which change is possible.
Your team has agreed on what it wants to accomplish. has developed an understanding of the principles of evidence-based practice and has taken a hard look at the current practices in this area. Now you're ready for step number 6, conducting a gaps analysis. This is where you define what the real gaps are between where you are now and where you want to be in the future. Do you have a good assessment in place? Does your case management approach in prison and the community effectively target the right offenders for your risk reduction programs? If not, what are the gaps and the barriers? What do you need to do to change that and close the gap between where you are now and where you want to be in the future?
Indiana had a very good example, I think, of using that step in the strategic planning process in that they took the TPC model and compared that with their current practices. And by going through that process, they could not only identify differences that existed between the model and their current practice, but they could also prioritize the things that would have the best results in the time allotted for the change that they wanted to take place in their agency. So as a result, they prioritized needs and could make changes in the operation of their system that were more consistent with what we know are good reentry practices.
By this point in the process, your team has developed a common understanding of the gaps that exist between what you want your practice to look like in the future and what it is at the present time. You are now ready for step 7, identifying priority targets for change. Having gone through the planning process together thus far, you are likely to be able to build a consensus within the team about priority gaps. This should make it more possible to get the commitment and momentum to move forward. Through a collaborative process, you will need to consider which of those gaps to try to address first, as you will likely not be able to make all the changes you need at once. You will want to consider which are easiest, low-hanging fruit, which are most urgent, and ultimately which are most important. But the key result of this step in the process is agreement about a limited number of priority targets for change, those that will have the greatest impact, those that the team will work together to implement.
In exploring work, jurisdictions may find that there are a number of things that they want to attack, a number of things that need to be addressed in order for them to move forward with effective offender reentry work. We need to create priorities concerning these targets so we know where to put our energy and where to put our emphasis. For instance, in Georgia, as they were working on the Georgia Reentry Impact Project, they determined that one of the missing ingredients, a key ingredient for their success, had to do with the absence of a good case plan that would follow the offender over time through their system. And as they became focused on moving forward with improvements in case planning, the coordination of case planning efforts, and the sharing of case plans across organizational lines, they found that this actually allowed them not only to focus their energy and attention well, but to move forward rapidly with changes in their system that were important to improvements in offender reentry work. Targeting, identifying appropriate targets of change, and dedicating energy and resources to those opportunities will help jurisdictions be more successful in achieving specific objectives.
Given that your team has done the work to identify and agree on targets of change, it's now time to get specific. By developing an implementation plan, the team, and here's where staff support is important, will need to agree on specific tasks to accomplish each major outcome. They will also need to agree on who is responsible for carrying out specific activities, who will help them, and to assure that they have the resources, information, access to leadership, adequate time away from other responsibilities, and guidance and support from the team as a whole when necessary. The timeline must also be established in order to keep the work moving, and the specific deliverables must be defined. The team will need to also sketch out a way to track progress. Weekly meetings, conference calls, email exchanges might all be part of the process. And there needs to be commitment for top leadership and team members at all levels that they will hold themselves accountable to finish the task.
An outcome winds up being a very effective unifying force, and we have a lot of agreement about how we think about outcomes in our field, mostly grounded in the notion of public safety and recidivism reduction, and there's certainly intermediate steps that get us there. But the importance of that is that once we agree on outcomes, the science that teaches us the ways to achieve that outcome also becomes a unifying force, and that science isn't limited by the boundaries of our agencies. And so if we lever off of the unity that comes from shared outcomes to the science that's used to produce those outcomes, we can get a collaborative environment where people's roles and responsibilities in helping to execute those outcomes are more clearly defined, and we build that competence off of that kind of a foundation.
Your team, both at the policy level and the implementation level, now have a very specific outline of what needs to be done. The time is to execute and do the work. Securing the attention and engagement of staff in all affected agencies is essential. Everyone needs to know why you're doing it, what you're going to do, who's going to do it, and when. Why are the activities and changes taking place? What's the goal? What will be the benefits? They need to understand what is being done, how they are affected, and what they need to do differently. They also need to know who will be involved and have a sense of the timeline. It's important to remember, nonetheless, that no plan is ever implemented exactly the way it was designed. Be flexible, adjust, and correct. The state of Georgia, as it was implementing the TPC model, went through a strategic planning process that generated a very clear implementation plan. When they had completed that plan, they took a series of very important steps to make sure that all of the agencies involved knew about the plan, knew the objectives, and knew what was to lie ahead. They developed a set of briefings and presentations that were offered to every warden in the state, every superintendent in the state, and every chief probation officer in the state. They also presented it at the annual meeting of the Georgia Probation Officers Association. And these presentations were designed to make sure that everyone involved in those agencies understood the goals of the plan, what was to happen in the future, and how they would be involved.
First, part of tracking and assessing your own strategic planning efforts requires that you keep a good written record. All of your sessions should have meetings recorded, prepared, and circulated to all members, so you have a clear, shared understanding of your plan, specific tasks, and decisions made along the way. Write it down. Secondly, as you decide to change policies and practices, you must be able to answer the question, did we do what we said we'd do? If we embrace the notion of good assessment, have we really put into place sound tools, applied correctly and in a timely way? That kind of question must be answered before you can ask the other questions. Did we get the kind of impact we want from the change? You should be measuring in a number of areas. First, what changes have we made in the way the system operates? Second, what indications are we seeing of increasing public safety measured by reductions in arrests, reconvictions, and returns to prison? Many jurisdictions are also measuring indicators of community strength, such as increases in restitution payments, employment, stable housing, and reductions in drug use. And for specific program investments, what has been the impact on participating offenders' outcomes?
One of the most important things we do in the long run is to determine, have we done what we said we were going to do, and has it had any impact? Too often we get involved in just doing the programs and not looking to the fidelity of the programs and the outcome of the programs. So Oregon's a good example. From the very beginning, they were very focused on outcomes. In fact, the Oregon legislature enacted legislation that mandated the use of evidence-based practices and programs over a period of time. So the Oregon Department of Corrections and their correctional partners, the community corrections agencies across the state, decided on not only final outcomes in terms of reducing recidivism and successful completion of supervision, but interim benchmarks, things that are important to the process, such as what percentage of offenders who left prison had stable housing, what percentage had stable housing after a year, What percentage of offenders in the community were employed? What percentage of offenders were assessed well, and prior to the time they left the Department of Corrections and went back to the community, if they were medium or high risk, did they have a collaborative case plan that the institutional counselor, the community corrections counselor, and the offender engaged in and concurred with? So not only did they measure the bottom line, which is important, they also measured the steps of getting there and reflected the process you have to go through to get someone prepared to be out and be successful, and once they're out there, to continue that success.
This project is designed to provide assistance to 2009 and 2010 Second Chance Act state adult demonstration sites, and has transmitted correspondence to each of these sites explaining the project and how to request assistance. The project team is prepared to work with these sites over a period of months, facilitating and supporting your efforts through on-site and off-site work with your team. To receive technical assistance, sites are asked to reply by December 15, 2010, to the correspondence sent to each of the Second Chance Act state adult demonstration sites. Your reply should take the form of a letter, in hard copy or as an email, to the Center for Effective Public Policy, stating your interest in receiving technical assistance for state-level strategic planning on reentry, the membership of your state strategic planning team, that each member of the team has viewed or will view this webcast, your willingness to work closely with our team during the assistance, and a completed strategic planning checklist attached. You are encouraged to refer to NIC's TPC Reentry Handbook on Prisoner Reentry at www.prisontransition.com/handbook/ for further information about the process of strategic planning, and to go to the National Reentry Resource Center website for the link to this webcast. We thank you for viewing this webcast and hope it has been helpful to you. We'll close with some parting thoughts from two of our project advisors.
One of the challenges that I think is that the offender can't just belong to corrections. The offender has to belong to society and to other portions of government. And I think we can look at this as a vertical or a horizontal slice. Vertically, we need to look and make sure we've got things in line in the corrections agencies. But horizontally, we need to make sure that we've got those other agencies engaged that control things like driver's licenses and identification and housing and other assistance that is necessary for successful reentry. So I think we have to look at it systematically, and I think that without a good planning process, it's business as usual and no change.
Good. So Nancy, you've been focused on data at the Urban Institute. What's the message to give folks about the importance of data?
Well, certainly when it comes to strategic planning, you really need data to help drive that decision-making process. Sites, jurisdictions that set out to try to understand what populations they want to focus their resources on really need to know characteristics of that population. That requires having data on everybody who's exiting prison and being able to understand their risks and needs. With that information, then, they can target resources and identify the subpopulations to work with and craft programs around those populations in a way that can be most effective.